Okay, backtracking quite a bit. Back to the start, back to the yearling sale. So again, this is something just to think about for a second. How do we reduce the risk of disease transmission after yearling purchases? So we know they're biohazardous, right? We know there's a good chance that if you buy a yearling, it's going to have something infectious in, on, around it. How do we reduce the risk? So this is why I said those kind of 3 concepts of infection control at the start, because those are the things I think we need to think about individually. How do we decrease exposure of other horses on the farm from that horse? How do we reduce their susceptibility in case they get exposed to something, and how do we increase their resistance? So if we think about this in terms of any disease risk or any disease we're worried about, it can really lead us a long way to making a logical approach to this. So realistically, this is the big thing, decreasing exposure. Reducing susceptibility, well, herpes virus, strangles, a lot of the stuff that's coming from the farm, there's probably not a lot I'm going to do to help kind of balance off their increased susceptibility. Increasing resistance is certainly important, because if something sneaks by, it'd be good to have vaccination against maybe influenza, herpes virus, especially if there's a broodmare, strangles, depending on the quality of the vaccines, which is a bit iffy, and how you approach it. But decreasing exposure is really the big thing. Because again, if equine flu doesn't make it from that yearling I just bought to the rest of my horses, they're not going to get influenza. Doesn't matter what else happens, they're not going to get influenza. So next concept, and this is obvious, but next one is quarantine. Right? So how do we prevent exposure? Well, we make sure the animal doesn't have contact with another animal. And it sounds easier than it is often, because quarantine isn't straightforward in a lot of farms, because you don't have space or personnel or time. Some things are shed for a long period of time. We're not going to buy a yearling and quarantine it for 3 years again. For all these things to work its way out of the system, we're looking for a short-term measure, but we know that short-term measures can have a big impact. And our highest return on investment for quarantine is within that first week or 2, when some of the bugs that's brought home from the sale just naturally disappear. There are a lot of infectious agents that get into a horse, and they only live there for days, weeks, short period of time, and the horse gets rid of them. And that's that group that we're trying to get rid of with quarantine. Quarantine also lets us get a look at them. So if the horse comes in, a couple days later, it's got a fever, it's got a runny nose, lymph nodes go big, it looks really depressed, well, maybe we're worried about strangles. And maybe I'm really glad I've got it here instead of in the main barn to prevent exposure. So quarantine is doing 2 things. It's preventing things from breaking out from that horse that might just be silently carrying it. And it's giving us a little bit of time to get an idea whether there's anything specific about this horse that might create a risk to everyone else. So quarantine is a very useful practice. It's very difficult in some situations. And like vaccination, I'm not going to say, here's how you quarantine, because that's farm specific. If you've got a separate barn that's not being used, that's over here, you got the rest of the horses over there, that's absolutely perfect. If you got people that can just work on your quarantine horses and not work on the others, that's great. If nothing can mix in between them and equipment and everything else, beautiful. Rarely is that the case. But what we try to do is take all the concepts of quarantine and apply them to the farm. Maybe you've got one barn and say, okay, well, we know we're kind of screwed for certain things, but we can put the horse in the stall here. We can make sure it can't go nose to nose. We can put up whatever, a tarp so it can't go nose to nose. We can make sure its stall gets cleaned out last. And the people that are going in there maybe wear different clothing or boots, wash their hands, and that its bucket doesn't go to another horse's stall the next day. So you can do quarantine in any situation, I guess, unless all you have is a 10 by 10 paddock and you put the horses in together, in which case, again, you're kind of out of luck. But it's taking these basic concepts and, again, figuring out how you can do them in the context of your farm. And maybe you can only do it for 4 or 5 days. Practically, you can't do it for 2-3 weeks. It's not going to be as good as 2 or 3 weeks, but it's going to be better than 0 days. So isolate as much as possible physically, so just spacing, procedurally, and that's kind of crossover with people and items and everything else that can pass things back and forth, and equipment. Take a look at them. So we don't just stick them in the quarantine stall and then come back a week later and see if they're still kicking. We look at them every day to identify problems early, because that can let us know if we need to do something sooner to get that horse out of quarantine sooner, and also for that horse's health. Consider disease screening. Most of the times we're not going to do this in your average farm. But we could say, okay, if you really are worried about strangles, what are we going to do? Well, we're going to say quarantine the horse, and we're going to say 3 nasopharyngeal swabs, 3 cultures in a row. And if it's negative in all 3, odds are very, very, very good it doesn't have strangles. Versus put it in the stall, and after 2 weeks, if it looks healthy, probably doesn't have strangles, but it could be a carrier. So again, it depends on the risk. If you have very, very, very high concerns about strangles, and you have some money to spend on testing, and you have some time, and you're going to act on the results of that testing, we can do some screening. Your average farm, it's not going to be done. And where we run into problems with quarantine is when you have to quarantine every horse all the time. So a horse going to a show would be great to quarantine it. If it goes to a show every week, we want to quarantine it for 2 to 3 weeks, and every horse in the farm is going to a show every week, again, we're kind of out of luck there, but it's trying to bring in these basic principles as much as possible. So again, another concept to take home with you is just think about what you can do in quarantine. A, do you need it? Is there anyone that comes into your property, or is everyone staying there? But if a horse goes off and comes back, or a new horse comes in, thinking about what you're going to do with that horse to prevent it from being the index case causing the farm outbreak. How long? I guess I covered this. Longer is better. 2 to 3 weeks is pretty standard. That gets us beyond the window. So what we're worried about for something is, okay, let's say the horse had influenza and it got better clinically right by the time you bought it. So you didn't really know it was flu because it was healthy that day. So how long does it take for some of these viruses to work their way out of the system when the horse is looking healthy? Usually that's fairly short term, actually, with a lot of them. And 2 to 3 weeks gives us a pretty good level of assurance that if it had something infectious that's transient, it's going to get rid of it. But 3-4 days helps out for a lot of these, especially influenza, which is pretty short term. Also gives you a bit of a window to see if the horse is getting sick. So I would ideally say a couple weeks, but I wouldn't discount even using a couple days if that's all you can do. So when to use it? Anyone new. Any new individual that comes onto the farm, that's someone you want to try to quarantine. But then there are high-risk groups. So an animal that's more likely to be biohazardous. So it comes from a sale. It's been to a show where you know there's been a problem. It comes from a farm that you know has a problem. And we know there are farms out there that have problems. It comes from an equine hospital. Now, people get a little worried when I talk about this. We don't like talking about equine hospitals. But equine hospitals, any equine hospital, is a risk for an infectious disease because, not necessarily because the hospital is dirty, because of what we do. If a horse comes into OVC, it's stressed, it might go on antibiotics. It's not going to necessarily pick up salmonella from being in the environment, but it might have salmonella in its gut that now it's expressing because we've stressed it and we've put it on antibiotics. And actually, most of the cases of things that we see of disease transmission are in the community. We're not worried about hospitals being focuses of infection, but we're worried about hospitals turning our horses that weren't overtly really infectious into infectious based on what we have to do. Surgery, stress, antibiotics, and all these things. So basically take home in there is don't assume all hospitals are biohazardous and don't go to whatever hospital down the road and say, I'm going to quarantine the horse from you because we said you're dirty. But consider that they go to a hospital, they're going to come home probably at higher risk than when they left. So what is quarantine good for? Well, it's good for things that are pretty short term. So it's good for equine influenza because they get flu, they shed it for a short period of time, and then it's gone. They don't have a long-term carrier state. It's great for that. An active herpes virus infection where they're kind of spewing a lot of it out their nose can be really good for it. An active or incubating strangles infection, same type of thing. Not good for some of these as well, not good for a strangles carrier. So not all horses that have strangles have disease. Some of them have the bug living in their throat or in their guttural pouches. And they can live there for a long time. So we can quarantine for 3-4 weeks, and some of these carriers are still going to be carriers. So it doesn't absolutely prevent it, but it's great for these kind of early active sick horses. Like I said before with herpes virus lives dormant in nerves in a large percentage of horses, including the strains that are more likely to cause neurologic disease. So we're not going to be able to prevent herpes virus getting onto a farm, but you're going to prevent these really actively high-risk shedders that are sick. Intestinal parasites, equine infectious anemia, which shouldn't be a problem for us around here. Something like Clostridium difficile, a cause of diarrhea that, again, healthy horses can carry for a while. Maybe good for something like salmonella, because they don't tend to shed salmonella for a long period of time. So if a horse comes into your farm with salmonella in its gut, so salmonella can cause diarrhea in horses and people, they tend not to have it for a long period of time. So if you quarantine it, reasonable chance it's going to get rid of it before it goes in the population. And then MRSA, when these superbugs, the resistant staph that we see in horses, they tend not to carry it, so they carry it in their nose, and they can get infections when they inoculate wounds in surgery sites or compromised foals and things like that. They tend not to carry it for a long period of time, though. So if you give them a little time to burn off some of these infectious things, it might be useful for us. So we've got really good, we've got maybe good, and we've got not so good. So again, quarantine is not infallible, but it's a useful tool that we can bring out in certain situations. So again, I'm not going to get into a lot of other reducing exposure things because don't have time, but some general concepts. Now, cohorting is just basically a fancy word for keeping like alike. So keeping certain groups of horses together. If you've got a lot of horses on a farm, it's much better to have certain distinct groups that stay together as opposed to a big, okay, I'm going to turn this one out with this one today and without the other one tomorrow. Because it's easier to keep things contained. Because if one horse gets sick and it gets exposed to a couple other horses, that keeps things contained a lot more than if it gets exposed to everyone. And if we take horses that are higher risk for one thing, a lower risk for something else, so if we've got brood mares, let's keep them over here. We've got yearlings, let's keep them over here, keep them together. So the yearlings that are higher risk for something like herpes virus, maybe don't pass it on to our brood mares. So it's identifying certain groups that we can keep together, again, in the context of doing what we want to do and need to do with the horses. Pest control, mosquito avoidance, again, it's going to come up this summer with West Nile and Eastern and everything else, how to reduce the risk of mosquito exposure, not absolutely preventing it because we can't, but reducing the risk. Hand washing. So these are the 5 biggest things for disease transmission, and these are the next 5 biggest things, kind of the line you'll see in human hospitals. How does hand hygiene work in horses? Well, we're talking about our hand hygiene, not the horse's hand hygiene, but we can think about a lot of the bugs that we get that we're worried about, strangles, herpes virus, flu, MRSA. Well, a lot of them are around the nose and the mouth of the horse. And how do we interact with the horse? Well, we spend a lot of time touching that. Might be petting, might be putting in bits. There's a lot of interaction there. So if we go in and you do that with one horse, and you go down the line, do that with the next horse, and down the line, do that with the next horse, if that first horse had strep equi, herpes virus, MRSA, whatever in its nose or mouth, maybe you've just inoculated the next bunch down the road. So ideally what we want to do is hand hygiene, hand washing, alcohol, hand sanitizers between horse contact. And we know it's not going to get done, right? It's not going to get done between every horse contact, but as much as possible. And whenever there's a high risk. So a sick horse, we want to do a little bit more. Or if we've got a really you've got a neonatal foal, a one-day-old foal, ripe for the picking for an infection, let's really make sure that we've washed our hands and are clean before we touch that foal. If we've got 5 or 6 kind of run-of-the-mill show horses we're playing around with, yeah, it'd be nice to be able to wash your hands in between, but probably not going to happen. But the more we can do to encourage that, I think it's really good. And the more we can use alcohol hand sanitizers because they're practical, right? Putting sinks in barns is difficult and expensive. Putting alcohol hand sanitizers up on the wall, very, very easy, very, very cheap, and they're equally effective to hand washing for most things. So alcohol hand sanitizers can be a great addition. Farrier and vet hygiene, and again, this is just something talking. Most vets and most farriers do this very well. We're not kind of the extreme like the pig and chicken vets, but thinking about things that they can do to reduce the risk of transmission of things from one farm to another, but it's a good general discussion to have with them. So what do they do to help prevent things from moving back and forth? And most of them will be happy to give you the whole chat about what they do. And if they're not, it kind of opens the door for kind of thinking what else you can do to reduce that risk.